if you're someone who really is open to just learning and growing as an individual, I think family medicine is the place for you. I think for me, family medicine just made sense. It made sense to my type of personality. It made sense to the kind of person that I am, and that I like to know a whole lot.
And another very important factor for me is the connectivity that we have with the patient, the connection that we have with the patient. Nothing brings me more joy of seeing that patient regularly and knowing and understanding all the background, why the patient developed the comorbidity, or why my patient is coming here in that way. Or if it's a patient that I've been seeing for the last 3 years that was always happy, now is withdrawn, and I know that something happened because I already know the patient. So I feel that family medicine allows me to connect with the patient in a deeper level.
Whenever you're in residency, you need two different kinds of support. One is from the home, the family support. The other one is from your, co-residents and your uppers. And that really makes a big difference when you're supported, because you tend to learn a lot more in a supportive environment. But the faculty is like on there. If you need something, they're always there. So that really makes a big difference, especially if you have a family too.
I feel our faculty is very engaged, and most of them also came from the program, so they understand us a lot. So it's someone that you can sit and be like, oh my God, this happened on this rotation and it was so bad. And they're like, oh, we've been through that, like life gets better. They know how to support us because they've been through it. They support each other, not only residents, but residents and faculty, and we get along very well. And I feel that because we were small, we are able to create a good connection among the third years, the second years, the first years, and the faculties. We meet, we talk a lot during the clinic when we are in wards. Residency is happening, but life is happening too. And the program is also very well on understanding that and adapting for whatever is needed.
So residency is residency, everywhere is standardized, but I think it comes down to very specific program based how you feel over there, because the learning is going to be the same at a base level, but then the support and what's happening in the program, it's very program specific. And I think the program here, it tries to bring everything together, and you can see that reflection when you're talking to the residents, you're talking to the faculty, and the way they handle the patients. And even when we are off service, even then we see the difference between the different programs and us.
And I can do so many different things with family medicine. That's exactly the goal that I'm going after I finish residency. You can do clinic, you can do the hospital, you can just do procedures, you can specialize in women's health, you can specialize in kids, you can specialize in psych, and
Sports medicine.
There's so many options, and you can tailor it at exactly the way that works for you.